Um, everybody's watching us, but nobody's watching the children. So I saw this story from a tiny outlet called the Owen News down in Owen County. That's about 30 minutes from me here in Bloomington. And it highlights a problem that is widespread throughout the state. So a a daycare center called Tiny Town Learning Academy closed this last week, marking another reduction in the available spots for childcare in Owen County. The YMCA their facility closed over the summer, meaning that since July, Owen County has lost 175 childcare spots, and in a small county, that is a lot. Tiny Town proprietor Stephanie Freeman estimates that approximately 60% of childcare facilities in the state have closed over the last 3 months, and this is a downstream effect of cuts to Indiana's child care voucher program, which now has a wait list exceeding 30,000 kids, with no new vouchers being issued until at least 2027. But Governor Mike Braun has a solution. Bring your infant to work. Braun announced a pilot program allowing state workers to bring newborns to the office. This Family First Workplace initiative has already launched for staff in the governor's office, the Indiana State Department of Health, and the state personnel department. The governor's announcement followed an executive order issued earlier this year that expanded paid childbirth leave and paternal leave, as well as paid leave for state employees who experience a stillbirth or infant loss. This program is going to be limited to infants less than 6 months old, and participating employees must submit a written request in writing, complete a series of documents, including a participation agreement and waiver, a pediatrician clearance form, a supervisor sign-off, and a signature from coworkers who agree to serve as alternate care providers. I think, Ross, I'm back to you to start this one. Man, like, if this isn't a Band-Aid on a bullet hole, and it's only for a very small slice of people, like state workers, right?
It seems like a Saturday Night Live skit, honestly. It seems like the format for a Saturday Night Live skit. What's childcare? I'm bringing my infant to school or to work. I mean, it's comical if it weren't real. To just see the stupidity of the people who are running our state. And creating a problem and then trying to come up with a solution that is utterly ridiculous. I mean, the one thing that I noticed, not one of the forms you have to sign is a waiver, right? A waiver of liability. It kind of tells you that your program might be messed up if the people who participate have to agree not to sue you over it. So look, utterly ridiculous. Nobody should be bringing their newborn baby out in public. Much less, you shouldn't be taking your newborn to Walmart where it can catch all kinds of diseases, much less to the BMV or wherever you're going to be taking your child. It just points out how bankrupt they are. They don't have any ideas. They just want to cut taxes for rich people. And ultimately, if you cut all of the taxes, you don't have any more money to do anything. And well, look, you just bring your kid with you and shut up. It's the stupidest thing I've ever heard. Among many, many, many stupid things. There's no defending this. It's laughable.
Cindy, now obviously this is a problem bigger than just Indiana. We don't handle childcare particularly well in this country in general. And it's good to have a federal candidate here, maybe ask about this. But should we be doing something at a grander scale on the federal level with child care in this country, with elder care? I myself am a fan of a federal jobs guarantee, and think that things like child care and elder care and things where we need bodies and a care economy, especially as AI is going to replace a lot of the you know, busy work jobs. Isn't this something we should be doing at a large scale?
It absolutely is. Child care has gotten just extremely expensive, prohibitively expensive. It's more expensive to work for a lot of families in order to have child care than it would be not to work. I think that is also by design, to keep wages low. We know that Project 2025's goal is to keep women in their place, which is right there with child care, elder care, dependent care, disabled persons care. And overwhelmingly, voters support child care programs, all of these paid caregiving programs. There are states who actually do this and do this really well, where family members are paid to care for their dependent family members, whether they're elderly, disabled, or younger. And this actually relieves the burden of people finding trustworthy care. And that's a big part of it is when you start creating programs and creating profit centers out of care, then the quality of care goes down. But I do think, yes, federally, we need to be addressing quality childcare programs, quality elder care programs. And, like I said, when this becomes a profit-making center and entity, the only winners are those who are lining their pockets. The people who need the care aren't the ones winning, and I think we need to be really cognizant of that as we go forward. And we see this with seniors in home care centers. I think it's $12,000 a month to house somebody in an elder care memory facility, and that's a national average. $12,000 a month. So,
and let me tell you, they're not getting the one-on-one care they need in those facilities. Right. There's just not enough bodies to go around, right? Just like there's not enough bodies to go around in these childcare facilities.
So it is a very complex problem. There's a number of childcare solutions I've seen proposed, everything from employer-based care to K-12 based care, which would extend that to, pre-K 12 based care. And I think we just need to start addressing things. And again, billionaires need to pay their taxes. When billionaires pay their taxes, the rest of us win.
Yes, 100%. Derek, again, this is one of those things where American exceptionalism, right? Like, we can't learn our lessons from other countries. If we look around the world, they know how to take care of their kids, but we don't even have to look that far. Like in Indiana here, we could look to a state that is very demographically similar to ours in the Midwest. Minnesota has paid family leave.
Mm-hmm. I think it's a case of they want you to have kids, and they're doing everything in their power to make you have kids. But once the woman pops the kid out, you're on your freaking own.
Yep.
We're not going to help you with anything. With the CCDF, the child care voucher program, it not only hurts new parents who've never navigated this system before, it also hurts the families who open up their homes for foster children. So it harms foster parents as well. So that has driven more people out of the foster care system that were going to be foster parents, because they were at one time given a lifeline of, hey, you can still work and be foster parents, and we'll help with the daycare for our wards of the state. And, you have a home for them. Now that's going away. And It's hurting a lot of foster parent and foster care agencies.
Yeah, geez, man. It's like they want us desperate so we're easy to control.